All right, team. So, some interesting news has developed in the world of dentistry over the last week. I didn't really have much to report, last week. So, we dove right into the controversies. But this week, we have a few new updates to share. The first, which I think was probably the most titillating, was Minnesota is now the first state that is offering licensure and certification for dental assistants to apply dental anesthesia or local anesthetics to patients. They can do like periosteal injections, super periosteal injections, and infiltrations, no blocks. But it's the first state to go online as offering their licensed dental assistants. They have to have practiced for 1 year in the state to be able to apply for the 45-hour program, CE program, that would give them certification to administer local anesthesia on patients. Now, this is a big change. I live in a state that just recently gave the licensure capability for dental anesthesia to dental hygienists. And we've only been doing that for a few years now. So we're already seeing the pendulum continue to shift. The belief is that this continues to be in response to the fact that many dentists are struggling to find support personnel, both dental assistants and dental hygienists. And so, one, offering career advancement within the dental assisting arena, but also maybe filling some gaps in the dental hygiene space as well if they're unable to find those that could currently administer anesthesia in their practice. So, Minnesota now online as the first dental assisting opportunity for local anesthesia. Another interesting story that came out of the ADA this week, they have sent a legal brief to the Supreme Court requesting that they pick up a particular case. Well, not really a case necessarily, but to look at a lower ruling that happened in the 10th Circuit Court of Appeals. So let's get into the weeds a little bit about dental insurance. So we've talked about this before on our program, but you have two kind of buckets in which insurance operates. You have those that follow state regulatory apparatuses or state laws, and then you have those that fall under ERISA or federal laws. Those that fall under the federal laws are typically federally funded programs like large government dental insurance programs, but also self-funded programs. So let's just say a large company like Google or Facebook might have self-funded plans because it's cheaper for them just to pay for their employees to receive care as opposed to paying a third party to administer it. One caveat: when you call the dental insurance company to ask, is this a self-funded or federal plan versus a state-regulated plan, you will not get an answer. They will not tell you. Now, why is this important? Because state plans fall under the state laws. So if your state happens to have a law that states that non-covered services are able to be billed at your current fee schedule versus those that are covered services, which would fall under your contracted rate, that's a big difference. Let's say you're doing 15 veneers on a patient. They have dental insurance. It's not going to be a covered procedure because it's an aesthetic case. You would like to bill them for the cost of doing that particular aesthetic service. And if it's a self-funded plan, you have to honor your contracted rate instead of falling under the state regulation that would allow you to charge your full fee. So the 10th Circuit Court of Appeals had a case that they were dealing with actually out of Oklahoma. They upheld the current operating understanding that the federal law will supersede the state law in those particular scenarios. The muddy water is incredibly difficult for dentists to be able to quote services to patients, to be able to honor that no surprise billing law that we're also held under as well. And so the ADA is now taken it to the Supreme Court and asked them to take up this case to make a final ruling on whether or not states' laws will apply for those cases where it is applicable versus federal laws. And if the state laws states that you are allowed to charge for non-covered services or whatever the nuances are of that particular state, that state law should supersede the federal law in which the insurance filing has occurred. It's very complicated and convoluted, but it is actually nice to see the ADA stepping in and saying, We want to advocate for the dentists in this particular scenario. We need transparency, and we need dentists to be able to operate within their own state laws because at least they know those laws. It's very straightforward at that point. And since you can't call a dental insurance company to get clarity on whether or not these are self-funded plans, government plans, et cetera, it would make it a lot easier to be able to quote patients appropriately. So we're watching that very closely. We'll see if the Supreme Court will take that up maybe in the fall. All right. The last little bit of information, which I found really interesting as a chewing gum chewer, is that a recent study just came out potentially identifying xylitol as an increased risk to heart attacks and strokes. This came from a press release from the Cleveland Clinic on June 6th. More studies will come from this for sure. It's the first red flag we've seen to indicate that maybe xylitol may have some adverse side effects, one of which we already know is digestive and intestinal distress, but it seems like there may be some cardiovascular contraindications as well. This is super important for us because many of us recommend gum chewing for salivary stimulation and for caries management, particularly ones that have xylitol in it. So we'll definitely be watching the development of this very closely. There was a large study that was released out of the European Heart Journal. 3,000 patients were reviewed and did identify at least an increased risk of cardiovascular events for those patients that had a higher consumption of xylitol in their diet. So we'll definitely be watching that very closely. And with that, that's the news.